Hi guys, I'm presenting on the Parents and Children Together intervention, specifically PACT. So what is Parent and Children Together intervention? This is a program that's specifically tailored for family-centered intervention for phonological impairment. So this means that teaching parents and family members to facilitate treatment just because they are with the child most of the time. So the target population for PACT is children who are 3 to 6 years old that have phonological impairment or just a speech sound disorder. This is due to the fact that it is a family-based intervention, so it is facilitated by the family and requires their support. Also, children don't necessarily get diagnosed typically until the age of 4, so this intervention technique or program allows them to get early intervention. So even if they aren't diagnosed, they can already start treatment. And the 3 to 6 range is also because they haven't started school yet, typically, because school will make it where there's a lot more barriers just because with different activities and such, they may not be able to be a part of this rigorous program because there is a lot that goes with it. So, and then another thing that they like to have is children who have not received speech therapy yet. And this is because, if a child has been in speech for a while, they may not be as receptive to this technique because, like I said, it is a lot. So we'll go into more of that later. Clinicians have used this technique with older children, but they haven't done studies with it on older children, just the younger ones. Okay, so PACT assessment and intervention. So this approach starts with a case history interview with the family. They do an oral MEC exam. They do a hearing screening and audiological evaluation. They do a quick screener, which is on the right of the screen, and they also screen for other language domains. So language, pragmatics, voice, fluency. The clinician who's doing the assessment will address the child's strengths and weaknesses, and then they will also do like a conversational sample with including at least 200 words. They'll also get an intelligibility rating, and they'll also use the family to obtain that, not just doing what they see in the assessment. Excuse me. Once the child is a candidate for the PACT intervention, they will use an attendance schedule. So as you see down there, and this is on your handout as well, we do 10 weeks of blocks. So this is 10 weeks of therapy and then followed by 10 weeks of a therapy break. So during the therapy break, the child will do some stuff with the family, not homework, but then for the next week, the therapy will decrease by 2 weeks. So instead of 10, it'll go down to 8, but we'll still follow by the 10 weeks of a therapy break, and then it'll keep continuing down. So the next time it'll be 6 weeks of therapy, 10-week break. So the therapy is once a week for 50 to 60 minutes. The family can be involved in 20 minutes total. This could be 20 minutes at the end of the session or just 10 minutes at the beginning, 10 minutes at the end. And this is intentional just because you want the therapist to be there with the child for the session and then family members to learn during their time, but not it taking up all the time. Also at each beginning of a block, so like at that 8-week one, they will reassess and they'll use that quick screener that you see, and they can also use various other tools like the HAP3 or any other testing that the clinician deems necessary to make sure that the child is still a candidate for services and they can continue, or if they need to terminate, they can terminate at that time. So PACT intervention continued. So whenever you're selecting targets for this child or um, when you're selecting targets, it will be completely individualized. And that's the beauty of this intervention program is because, the child's with the family and you get to talk to the family and figure out what's best for them and what works best for them and what works best um, for the child based on their name or something that they're using often. Um, it is family centered, the initial assessment, the treatment sessions, and the homework. So, therapy. So, it starts with parent education, and this is where they target, as you can see here, self-modeling, self-correction, how to praise, and focused auditory input. Then, excuse me, within PACT, there are components in areas which the therapist targets with the child based on individual needs. So first we have metalinguistic training, and this is where parents and child and therapist talk and think about speech sounds and the way they convey meaning. So then we have the phonetic production training, and this is how the therapist teach the child how to make the sounds that they have difficulty with, and they work on with the parents to listen at home with and like incorporate games into it. And so the therapist and the family members have like a 50-50 split. Then we have multiple exemplar training, and this is where the parents and the clinician um, read word lists to the child, and the child will learn words according to their sound properties. And I have examples of this one on the next slide. And then specifically homework during the therapy blocks, the parents will perform tasks that they are doing in therapy, and they do it 1 to 3 times per day for 5 to 7 minutes to just not overwhelm the child. Okay, so my therapy activity is a boy who is 5 years, 2 months. His name is Madden, and he is a candidate for the PACT intervention, and his family is deemed that this will work for their schedule. So the activity that I'm going to do with him is the multiple exemplar training. So I would tell him, point to the one that I say, and he'll have pictures in front of him as like, you see these pictures in front of you, and he'll point to the corresponding picture. So point to the one I say, cow, and then he'd point. And then another one could be, you be the teacher. Tell me if I say these words right or wrong. And then the child will judge the clinician's production. So these are just a few examples of the multiple exemplar training, and I have more in the handout. And then lastly, here are the strengths and the weaknesses of PACT. So it's individualized, which it's based on the client's needs, which is so beneficial. And then it's accessible with the population being 3 to 6 year olds. They can access them and they can do the needed therapy blocks and breaks. And it can be beneficial because it helps the families with planning. And it's family centered. So it's completely, up to the family what you're targeting. You're collaborating with them on every aspect of this intervention. And then in regard to weaknesses, I would say the first one is parent involvement. Just really hard because with the blocks and breaks, you are having to make sure that it isn't too much. And then also with the parent education, it comes along with this approach. You have to teach them. And then if the parents aren't motivated or ready to be active participants whenever they're doing PACT, the progress of the client can suffer. And then another one is maintaining the approach for the full duration. It is a long approach, but it is deemed beneficial. So again, progress could suffer. And then lastly, logistical challenges. I mean, this approach has a lot of sessions as well as a lot of parent implemented intervention, and it can be hard to schedule all of the sessions and plan around work and implement homework if there's multiple kiddos because the parents just can't do it. Then lastly, here are my references.